Good afternoon, everyone. This is Christine at Health Current, and thank you for joining us for today's Promoting Interoperability PI Program Open Forum on Meaningful Use with a focus on Objective 5, Patient Electronic Access. This presentation is provided through a shared commitment between Access, ADHS, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability or PI program. A few logistical reminders. We will be using Poll Everywhere throughout the presentations for attendees to participate in live polling and see the results live. Follow the instructions on the screen to either join via the web or your mobile device. Again, the instructions are right here. You can join via your computer at pollev.com. Enter in EO program 753. That is not case sensitive, and that will allow you to respond to the activity on your computer, or you can go to your mobile device and text the word EO or text EO program 753 to the number 22333. And that way you'll be able to participate in live polling today. We encourage you to ask your questions or comments using the chat feature. You can also raise your hand if you want to do that through WebEx, and we can open your mic so you can speak to the group. Please remember to include your name, any practice or organization. Please do not include any confidential information such as patient health information or PHI. Today's open forum will be recorded and posted to the Health Current and Access websites. We will keep all lines muted throughout the beginning of the presentation, and again, encourage you to raise your hand if you have questions. Connie, are you with us?
I am. Can you hear me? Hello?
Yes, I can.
Very good. Thank you, Christine. Today, I have the honor of introducing Priscilla Clark as Senior Accountant with Myers and Stouffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, is our open forum presenter today. Priscilla, you may begin your presentation.
Thanks, Connie. So today's presentation is actually going to be presented by me, Alicia Jones. Priscilla was not able to join for this presentation. So my name is Alicia Jones. I'm with Myers and Stouffer as well, and I'm a manager with the firm. So today's presentation is an open forum for meaningful use, focusing on patient electronic access. The format of today's presentation is different from how we've done presentations in the past if you've attended these events before. So we're going to go through a couple of slides, really short presentation over patient electronic access. We'll ask some polling questions, and then we really want to open up the floor to everybody that's on the line, and we really strongly encourage participation. So don't be shy. If you have questions or if there's anything that you would like to discuss, feel free to chime in. Next slide, please. All right, so for patient electronic access, before attesting, make sure that you understand the patient electronic access objective requirements for the Medicaid Promoting Interoperability Program, understand the differences in Objective 5, patient electronic access, between program year 2019 and program year 2020, and make sure you know Arizona's patient electronic access documentation requirements. Next slide, please. Objective 5, patient electronic access. The objective is that the eligible professional provides patients or patient authorized representatives with timely electronic access to their health information and patient-specific education. There are 2 measures under this objective, and EPs have to satisfy both measures for the objective through a combination of meeting either the threshold or the exclusion for each measure. Next slide, please. The first measure under this objective is that for more than 80% of all unique patients seen by the EP, the patient or patient authorized representative is provided timely access to view online, download, and transmit his or her health information, and the provider ensures the patient's health information is available for the patient or patient authorized representative to access using any application of their choice that is configured to meet the technical specifications of the Application Programming Interface, or API, in the provider's Certified Electronic Health Record Technology, or CERT. So we aren't planning on getting into the details of exactly what an API is because we have done prior presentations. So the Program Year 2019 presentation on this objective is posted on Access's website, along with the Program Year 2020 version of the presentation. There's slides along with FAQs and a lot of really good educational material, which we have linked at the end of this presentation. So while we're not planning on getting into the details of that during this particular presentation, if you have questions about it, feel free to ask or chime in with your thoughts. And then another thing on this slide that I wanted to point out is the use of the word timely. So in the first bullet point, it says the patient or authorized representative is provided timely access. So what exactly does that mean? And the answer to that question is different depending on whether you're looking at Program Year 2019 or Program Year 2020. So I wanted to make sure to point out that there is a difference between those two program years. For Program Year 2019, CMS allowed flexibility to where the API did not have to be enabled until the end of the calendar year. So you still had to provide the VDT, view, download, transmit access to your patients, but the API itself did not have to be enabled until the end of the calendar year for 2019, which of course is December 31st of 2019, because there was confusion around what the word timely in the measure meant. Now going forward, CMS has clarified that word to mean that it is 48 hours from the date that the information is made available to the EP, which in most instances is the date of the encounter. So for 2020, that API access has to be made available within 48 hours. So there is a difference there that I just wanted to make sure we reiterated. And that is only for Objective 5, Measure 1. Next slide, please. Then there is a second measure under Objective 5, which is that the EP must use clinically relevant information from CERT to identify patient-specific educational resources and provide electronic access to those materials to more than 35% of unique patients seen by the EP during the PI reporting period. Now, there are no differences in this measure between 2019 and 2020, so you don't have to worry about understanding the changes there. Next slide, please. And now we wanted to ask the audience a couple of polling questions. And for these polling questions, there's no right answer. This is just to get some information from the audience. Christine, I'm not seeing your full screen. I'm seeing a big gray box.
Huh. Okay, let me see what I can do to fix that.
And Connie, I'm not sure if I'm the only one. Connie, can you see her full screen?
No, I can't. I'm seeing the gray box as well.
Okay, so I'll read the question aloud, and while Christine works on that, and so you guys can go ahead and be entering in your responses. The first polling question is the API function in your CERT enabled? So is the application programming interface functionality in your certified EHR technology enabled currently? Your options are yes, no, unsure, or N/A for not applicable. So you'll use that same phone number that you utilized earlier in the presentation to type in your favorite ice cream flavor. You can just text your response there, or you can use the website option. Christine, do you see answers coming in?
I think we should maybe try sharing your screen, Alicia.
Well, I don't have the poll everywhere, so it'll have to be Christine's screen.
I apologize, everyone, for the technical difficulties.
That's okay. And then just to clarify, you'll want to enter in A for yes, B for no, C for unsure, or D for not applicable.
I'm seeing it now, Christine.
Oh, okay. Are you seeing the split screen or are you seeing the presentation?
Right now I see your slides, but not in presentation view.
Can you see the screen now?
Yes.
Okay. Can you see the whole screen?
I believe so. I see 33% for A, 67% for D, and 100% for not, well, that can't be right. 100% for D. I think it's glitching.
Well, for some reason, I'm getting like a slide over slide. It's really weird. Okay. Now, can you see it?
Yes, I think that it looks right. So 33% for yes and 67% for not applicable.
Yes, that's what I'm seeing.
Okay. All right. So let's talk about that. So we have 33% of participants that answered yes, that your API functionality in your cert is enabled. So that's great. For participants that answered not applicable, my assumption is that that's most likely access staff members or maybe other IT folks from companies that are not actually providers or practices. Then that's correct. That would not be applicable to you. If you are a provider that entered not applicable that is planning to attest to program year 2019 or program year 2020, I would reiterate that this is applicable to you. That in order to meet Objective 5, you do have to have the API functionality in your cert enabled in order to successfully attest for the program. It looks like we didn't get any no responses, so that's really good. And Christine, we can move on to the next polling question.
Okay, are you seeing it full screen or are you seeing a picture-in-picture with next slide?
Picture-in-picture with next slide. All right, the second question is.
No, I don't know. I apologize again. I'm not sure what this is.
That's okay.
Maybe we've got it now. Okay, can you see it now?
I'm still seeing the big gray box. I think it's behind the gray box. I can see the little icon and the number 2. But yeah, I don't see the question. I think if we can just see your split screen, I think that's fine for now, if you're okay with that. That way, that seemed to be the best option where we, oh, I can see it. It went away.
I think it has to, something weird is going on with my laptop here. Okay, there we go. Okay, we're gonna try this. Okay, can you see it now, Alicia?
Yes.
Okay.
Okay, so the question is, does the practice have an application that interfaces with their CERT via API? And again, API is that application programming interface. So you'll enter A for yes, B for no, C for unsure, or D for not applicable. And we'll give everybody a second to respond to that poll. Okay, we'll give about 1 more minute just in case there's any additional responses. Okay, I don't see any additional responses coming in, so we'll go ahead and discuss. There is one no response, that there is not an application that interfaces with the CERT via an API for that organization. I think this one is a little bit tricky. The wording of the question is a little bit tricky because when you think of an application, you think of something like Apple Health on your iPhone, where if you have Apple Health and it's configured to work with the practice's CERT, then your patients can enter their health information into their Apple Health, and it will it can be transmitted to the CERT via an API from Apple Health directly to the CERT. Now that's one way that you can meet this requirement, but there's also your typical patient portals that could be interfacing to the CERT using an API. For example, if you have NextGen and your patient portal is Relay Health, those two separate systems may be interfacing with one another via the API. Now that could qualify, even though it's not technically an application, there is still availability or the patients can still access their health information via the API, which is through the patient portal. So that can still qualify even if there's not an actual application like an Apple Health on your iPhone that interfaces with the CERT. So I guess don't panic if you don't have an application. Check and see how your patient portal is connected to your CERT, if it is a separate system. For those that answered not applicable, again, I'm assuming that those are not practices or not providers. But if you are a practice or a provider that answered not applicable, I would emphasize that this is applicable to you as it relates to Objective 5, Patient Electronic Access for program year 2019 and 2020. All right, we can move on to the next polling question. Polling question is, does the practice provide information to patients regarding available applications that leverage the API? A, yes, B, no, C, unsure, or D, not applicable? All right, we will go ahead and start discussing, but feel free to continue to add your responses. There was some no responses that no, the practice does not provide information to patients regarding available applications that leverage the API. That's actually a requirement that is specified in the rule for this measure. CMS indicates that providers or practices do have to provide information to their patients regarding available applications that leverage that API. Now, again, if you don't have an actual application, the information could look like how to access the patient portal. So I guess keep that in mind. And there's a bunch of different ways that that information could be provided. CMS does not specify the manner in which the information has to be given to patients. So we've seen a couple of different options, I guess you could say. We've seen providers post a flyer in their waiting room about the available applications, or post a flyer maybe next to the check-in or check-out screen or sheets, I'm sorry. We've seen providers send out mass emails with information about the available applications. So there are a bunch of different ways to do the same thing. You just have to make sure that that information is provided to all of the patients in 2019 by December 31st of 2019, or for 2020 within 48 hours of the visit. And again, that is in the rule, that is a requirement to meet the objective. So that is going to be documentation that is requested by Access. All right, we can move on to the next question. Does the practice provide instructions to patients on how to authenticate access to the API? A, yes, B, no, C, unsure, or D, not applicable? Okay, so far I'm seeing 100% of responses for D, not applicable. Again, you can feel free to continue to input your responses, but we'll go ahead and discuss. So another one of the requirements in the rule is that practices or providers give instructions to patients on how to authenticate their access. So that sounds kind of confusing for someone who's not in IT, right? What does authenticate access to the API mean? It can be something as simple as, how do I connect my app to my patient portal or to the provider? So how do I set that up? Or if it's a patient portal, how do I get a login and a password? So I guess don't let the terminology confuse you. It's much more simple than it sounds. And those instructions are often provided with the list of applications. So you could have a one-pager flyer on how to set up your patient portal, or how to connect your Apple Health, for example, to your patient portal. And then if there's any additional applications that are available, what those are. So that can all be sent out at the same time. Again, that can be posted in the waiting room. That can be posted by the check-in or check-out sheet. That can be sent out in a mass email, just as long as it meets the timing requirements for whatever program you're attesting to. And again, that's a requirement of the measure, and that is something that will be requested by Access. Okay, next question. Do you plan to attest for program year 2019? A, yes, B, no, C, unsure, or D, not applicable? Ideally, if you are entering no, it would be great if you could type in the chat box maybe why you're not planning on attesting to program year 2019, and we can address that. Or if you are a provider or organization that entered in not applicable, why you feel that the question is not applicable to your organization. Okay, I'm seeing 100% not applicable. So I guess if there are any providers or provider practices on the line that answered that or did not answer the question, feel free to type in the chat box your reasoning, and we can always come back to that. All right, next question. Do you plan to attest for program year 2020? A, yes, B, no, C, unsure, or D, not applicable? And again, if you're answering not applicable or no, and you are a provider or from a provider clinic, please type in the chat box your reasoning for that response. Okay, not seeing any other responses come in, so we'll go ahead and move to the next question. What is your biggest concern attesting to program year 2020? So this one is open-ended, so there's not an A, B, C, D response. You can type in whatever you want. If you're not a provider or provider group, but you're listening to this presentation, you can type in your biggest concern for program year 2020, just in general. It doesn't have to be about attesting to program year 2020. And since this one requires more typing, I'll give you guys a little bit longer to respond. Okay, I'm just seeing one response. So I guess if you're having any issues with the Poll Everywhere software and you're not able to enter it or you're not sure how to, you can also use the chat box to enter your response for your concerns attesting to program year 2020, and we can come back to you and attest or address that. Okay, we can go ahead and move on to the next question. What PI program topics would you like to see more of? Again, this one is open-ended. Feel free to type whatever you'd like. All right, I'm not seeing any responses. If you're not a provider or provider group, you can still enter in what PI program topics you would like to see more of. If you have any ideas, we're open to hearing suggestions. Again, if you're having difficulties, please enter your comments in the chat box. Okay, we'll go ahead and move on, but you can still feel free to enter your responses in the chat box if you'd like to. Okay, and I believe this is our final polling question. Would you like to be contacted for further assistance? A, yes, B, no, or C, not applicable? Okay, looking like 100% not applicable, so we'll go ahead and move on. If you would like to be contacted for further assistance and the polling questions weren't working for you, feel free to enter your chat box enter in the chat box your name and email address, and someone from Access will reach out to you. All right, next slide, please. Here are some resources specific to the patient electronic access objective that will be helpful to you when you're testing or if you're helping other providers to attest. The first one is the CMS Objective 5 tip sheet. The second one is the Access Patient Electronic Access webinar. If you go to that link, it will take you to the Access website, and there's a drop-down menu where you can view all of the presentations that we've done for this program. It's all in one place. You'll see all the presentations, all the FAQs, and tip sheets that Access has put together on various topics. So you'll see both the Program Year 2019 and Program Year 2020 webinars there, along with the Patient Electronic Access FAQs for both years. And then the next resource is the CMS Broadband Access Exclusion. CMS put out a tip sheet about the broadband exclusion. That is one of the available exclusions for this measure. And just so everybody knows that broadband exclusion is not available to EPs in the state of Arizona. So if you would like more information on why or what counties are able to use that broadband exclusion, that information would be contained in that tip sheet. The next resource is the federal final rule for modified stage 2 and stage 3. So of course, for obvious reasons, that's extremely helpful. And then again, if you go to the Access website, you will see all of the webinars and presentations that we have done previously. So if you have any questions about any of the material there, feel free to reach out and we will answer those questions. Next slide, please. And we wanted to emphasize some future webinars that are coming up. We have the Program Year 2020 Stage 3 Requirements webinar. That's next week on August 13th, 2020. And you can click the Register Here button. This presentation will be sent out to participants as well as posted on the website. So you'll actually be able to click that link and go and register for that webinar if you'd like to. The next one is the Program Year 2020 Objective 8 Public Health and Clinical Data Registry Reporting webinar, which will be held in September, on September 17th. Then we have the Program Year 2020 Clinical Quality Measure webinar, which will be on October 8th. Then the Documentation Retention webinar, which will go through every measure and what exactly is required in terms of documentation for each of those measures. That will be on November 5th. There is one already on the Access website for Program Year 2019. The one that is coming in November will be geared more towards 2020. So there may be some slight updates there. And then we'll have another open forum focused on the Program Year 2020 checklist for EPs on December 3rd. All right, next slide, please. And as I mentioned, if you had any difficulty with the polling questions or you would like additional assistance or you have questions that you're not able to get answered today, you can feel free to reach out to Access via this email address. It's the EHR incentive payments at azaccess.gov. There's also a phone number listed here. And we also have Health Current's email address and phone number listed as well. All right, next slide, please. Okay, and like I said, this is an open forum, so we want to encourage open dialogue. If you have questions, it doesn't have to be a question. You could just make statements, share your thoughts specific to this measure. We would like to keep it focused on patient electronic access. So I think we're going to keep the lines muted just to prevent excess feedback into the presentation. But if you have anything you'd like to contribute, feel free to unmute your line and chime in.
Alicia, I'm not seeing anything in the chat box at this point.
Okay, so we still have 20 minutes left in our presentation. So what I'll do is, Christine, if you could pass the ball to me.
Okay,
I'm going to share.
Pass the ball. Yep, you got it.
Okay, great. All right, can everybody see my screen?
Yes, I can, Alicia. Thank you.
Yes.
Okay, great. All right, so in the meantime, what we'll do is we're just going to go over some frequently asked questions related to the patient electronic access measure. Again, we really want this to be interactive and an open discussion. So if there's at any point you have thoughts, even if they're not related to what I'm discussing at the time, feel free to interrupt me, chime in. That's completely fine. All right, so again, how does an EP meet the patient electronic access objective? There are two measures for the objective, and the providers have to either meet both of them or they have to meet a combination of the threshold or the exclusions for both of the measures. We talked a lot about view, download, and transmit. So what exactly do those terms mean? View online means the patient or the authorized representative is able to access their health information online. Download means the information can be moved from online to physical electronic media. Transmit means the movement of information by any means of electronic transmission according to any transport standards. So some examples are SMTP, STP, REST, SOAP, etc. However, the relocation of physical electronic media, for example, USB or CD, does not qualify as transmission. It has to be an electronic transmission. And then the last one is API, which is the technology that works behind the scenes to help software programs communicate with each other. For patient care, it allows patients to connect to the provider's cert to gather and share health information. So for a lot of providers, that term API is like a foreign language. We don't understand what application programming interface means. So I think that's a good definition, that it's behind the scenes. It's what connects to sources of information, like an application on your phone and your patient portal that is a part of your certified EHR. The API is the piece that makes those two systems be able to talk and communicate to each other. All right, what does access entail in meeting Objective 5, Measure 1? A patient should possess all of the necessary information needed to view, download, or transmit his or her information. And this could include providing patients with instructions on how to access their health information, the website address they must visit for online access, a unique and registered username or password, instructions on how to create a login, or any other instructions, tools, or materials that patients need in order to view, download, or transmit their information. All right, the next one is, what does timely mean in meeting Objective 5, Measure 1? And we discussed this earlier in the presentation, and this is the response to this is different depending on whether you're looking at Program Year 2020 or Program Year 2019. This FAQ is for 2020, so it says EPs must make a patient's health data available to the patient via view, download, and transmit within 48 hours of information being available to the EP. Now, if we're talking about Program Year 2019, instead of the 48 hours, it has to be just by the end of the program year, December 31st, 2019. And that, let me clarify, is specific to only the VDT, or I'm sorry, it's specific to only the API piece. The view, download, and transmit access still has to have been available within the 48 hours. What is an application programming interface? A set of programming protocols established for multiple purposes. APIs may be enabled by a provider or provider organization to provide patients with access to their health information through a third-party application with more flexibility than is often found in many current patient portals. What is the difference between an API and an app? An application or app is a software program designed for individuals to use on a mobile device. Apps are usually downloaded by a user to their smartphone or tablet, whereas an API is a set of routines, protocols, or tools that governs how applications interact with another software program or application. For example, patient portals are often interfaced to the certified EHR technology via an API. An API connects the data from the app to the cert. To implement an API, does an EP need to fully enable the API functionality? The answer to that is yes. To implement an API, an EP needs to fully enable the API functionality such that any application chosen by a patient would enable the patient to gain access to their individual health information, provided that the application is configured to meet the technical specifications of the API. So if you're hearing all this and you're not sure whether your API is enabled or not, then what I would encourage you to do is to reach out to your cert vendor. They should be able to tell you whether your API is enabled. If your API is not enabled, then you still have time for 2020. It's too late for 2019, but for 2020, we would recommend you go ahead and enable that API functionality now so that you have some options for a 90-day period where that functionality was turned on, still remaining in calendar year 2020. Is an EP able to prohibit patients from using certain applications? No, the EP may not prohibit patients from using any application, including third-party applications, which meet the technical specifications of the API, including the security requirements of the API. So basically, if there's an app that does work with your cert and is configured to meet the technical specifications of the API, the provider can't say, no, you can't use that. Are EPs required to offer all 4 functionalities: view, download, transmit, and access through API to their patients? So the answer to that is yes. EPs are required to make patient health information available to the patient for all 4 functionalities, which includes view, download, transmit, and access through the API in order to meet the measure. Now, the patient doesn't actually have to have access to it, but they have to be able to if they chose to do so. Where they actually do access it, that comes into effect in another objective. That comes into play in objective 6. But for this objective, you're just looking at, do they have the capability of accessing that information? Whether they choose to act on it or not will not impact whether or not you meet objective 5. Are EPs expected to provide patients with detailed instructions on how to authenticate their access through the API? Yes, EPs are expected to provide patients with detailed instructions on how to authenticate their access through the API. And the EPs have flexibility to determine how the information is communicated to their patients. However, the EP must be able to provide supporting documentation showing how the information was communicated to the patient. So we talked about this a little bit earlier, how there's multiple different options for you to communicate this with your patient. Now, if it's a flyer that's in your waiting room or something like that, you would need to still be able to support that. So you would want to make sure you have a copy of the flyer that you can provide, and that you would also need to explain how it's displayed, that it is displayed to all patients at all times, and that would meet the timing requirement. So you would need both of those 2 pieces. If it was a mass email, you would want to provide a copy of the email and explain how and when that information is transmitted to the patient. The next question is, are EPs expected to provide patients with supplemental information on available applications that leverage the API? Yes, EPs are expected to provide the patient with supplemental information on available applications that leverage the API. Again, this is something we talked about earlier, where EPs have the flexibility to determine how that information is communicated to the patient. You just have to be able to provide supporting documentation. All right, Christine and Connie, have we had anything come up in the chat box?
We have not yet.
Okay. Again, if anybody wants to chime in, feel free to do so. We want it to be very interactive. Okay. The next question is, must an EP have identity verification processes to ensure that a patient using an application which is leveraging the API is provided access to their health information? And the answer is yes, an EP should have identity verification processes to ensure a patient using an application which is leveraging the API is provided access to his or her health information. This is similar to how EPs support patient access to view, download, and transmit capabilities. Does an EP have to offer view, download, transmit, and access through API to his or her patients within 48 hours of the patient visit? The answer to that is yes, an EP must offer all 4 functionalities to his or her patients, and PHI needs to be made available to each patient for view, download, transmit, including via the API within 48 hours of the information being available to the EP for each and every time that the information is generated, regardless of how long the patient has been enrolled. Now, again, that is specific to program year 2020, where it's 48 hours across the board for all 4 functionalities. In 2019, again, you had a little bit more flexibility on when the API access had to be provided. The API access could have been provided by the end of calendar year 2019, and you would still meet the measure potentially, assuming you meet all of the other criteria of the measure. The next question is the EP allowed to leave one or more fields in the patient file blank if there's not information available? And the answer is no. In circumstances where there's no information available to populate one or more fields, either because the EP can be excluded from recording such information or because there's no information to record, for example, no medication allergies and no laboratory tests, the EP may have an indication that the information is not available and still meet the objective and its associated measure. So instead of leaving blank, you would just put not available or something similar to that. If a patient has multiple encounters during the PI EHR reporting period, does the EP need to provide access to the patient for each encounter? And the answer to that is yes. A patient who has multiple encounters during the PI EHR reporting period, or even in subsequent reporting periods in future years, needs to be provided access for each encounter where he or she is seen by the EP. And I think we've talked about this one a lot, but what changed between 2019 and 2020 is the timing of when the API must be enabled. Otherwise, and because of that timing difference, there are some documentation differences in what's required for 2019 and 2020. But otherwise, outside of that timing requirement, the measure itself is not different between the 2 program years. Okay. Did I see a question pop up?
Yes, Alicia. If the API was available, documentation was provided to patients, but no patients use the API during the 90-day reporting period, will the EP pass the measure?
So that's a good question, Juliet. So for the objective 5, if the API was available, meaning the API functionality was enabled, and the documentation about the instructions and the available applications was provided timely to patients, then they've met the criteria of the measure, assuming their numerator and denominator meets the minimum threshold. I'm getting some feedback. Would everybody mind muting their line? Okay. All right. So again, just to make sure you heard me, if the API was available, meaning it was enabled, and your documentation in terms of the instructions and available applications was provided to the patients within the time frame required by the measure, and your numerator and denominator meets the minimum threshold of the measure, then yes, you would pass the measure. Just because there are no patients that actually use the API to access their information, that doesn't matter for Objective 5. In fact, as long as you've provided access, you could have 0 patients that actually access their information, and it would not impact Objective 5. Now, it would impact Objective 6, where it does require patient participation and a certain percentage of patients actually accessing their information. But again, it doesn't have to just be through API. They could have accessed it through view, download, or transmit. So if you didn't have anybody using that API functionality, as long as it was available, you should be good for Objective 5 and potentially Objective 6 if you still had patients accessing their information through the other means. Okay, thank you, Juliet. All right, we will continue going through the FAQs. Again, feel free to chime in if you guys have any additional questions. Okay. The next question is, what documentation must be submitted to demonstrate that the EP meets Objective 5 Measure 1? So your EP should submit a CERT-generated dashboard, and that dashboard needs to show the provider's name, the numerator, the denominator, and the measure percentage. You'll also want to submit a copy of the instructions that were provided to patients on how to authenticate their access through the API, as well as a copy of the information given to patients on the available applications that leverage the API. There are some situations where a non-CERT generated report may be necessary, but the use of non-CERT generated reports I guess, should only be used if you absolutely need to, and it would need to be approved. That process would need to be approved by Access. All right, and then also if the patient or if the provider is using the opt-out patients to meet the measure threshold, additional supporting documentation is required there. So opt-out patients are patients that have opted out of accessing their information electronically. Typically, that means they filled out some sort of form saying they don't want access to their information via the patient portal or whatever other mechanism. Those patients can be added to the numerator as long as they were still able to access their information through the VDT or the API, and they just chose not to, and they're able to opt back in at any point without additional action on the behalf of the provider. And you also need to be able to support that those patients opted out, that the patients were seen by the provider during the 90-day period that you're testing to. So there is more information included in that patient electronic access presentation that is posted on Access's website. It'll give you more specifics and more details on what's required around opt-out patients and what that documentation needs to look like. But so basically, if your measure percentage is below the minimum threshold, you may still be able to qualify as meeting the measure if you had any patients that opted out that could be added to the numerator. And again, this is for 2020, so there's some additional documentation requirements for program year 2019 surrounding when the API was enabled and how your CERT dashboard was tracking API and VDT access. And depending on the responses to those questions, there may be some additional supporting documentation that is required. So I would emphasize to anybody that's interested in that to go and review the 2019 Patient Electronic Access webinar, as well as the Patient Electronic Access Frequently Asked Questions and tip sheet for program year 2019 to gain a better understanding of what those documentation requirements are. All right, we have just a couple of minutes left. Do we have any additional questions or thoughts that anybody would like to add?
Alicia, we're not seeing additional questions in the chat box at this time.
Okay. Well, we will utilize the full extent of our time today, so I'll go ahead and continue reading some questions. If you come up with anything in the next couple minutes, feel free to chime in. All right, the next question is, are paper-based actions allowed to be counted in the numerator for Objective 5, Measure 2? And the answer is no, paper-based actions are not allowed to be counted. EPs may provide paper-based educational materials, but they may not be included in the measure calculation. And again, that's related to Measure 2. So we've been talking a lot about the API requirements today, and that's all related to Objective 5, Measure 1. Objective 5, Measure 2 is providing patient-specific education resources. The next question is, we'll skip 19. Number 20 is an EP allowed to post materials from other resources to the patient's portal account in order to include the patient in the numerator for Objective 5, Measure 2. For a patient to be included in the numerator, the patient-specific education resource information must be based on data included in the patient's problem list and medication list in accordance with at least one of the following standards and implementation specifications. So it's the standard and implementation specifications in 170.204B3 and B4. The CERT must be able to electronically identify patient-specific education resources. So basically, your CERT could look at the diagnosis code. Does the patient have diabetes? Is the patient pregnant? And then maybe there are patient-specific education resources that the CERT would recommend based on whatever the patient's condition is. The EP is not able to count a patient in the numerator if the EP manually finds a patient-specific education resource and puts the material in the patient's portal account. So again, the material has to be electronically identified by the CERT based on the patient's information. All right, so what is the documentation that's required for Objective 5, Measure 2? You'll need to submit a CERT-generated dashboard that includes the provider's name, the numerator and denominator for the measure, and the ultimate percentage. Again, a non-cert generated report may be necessary, but the use of non-cert generated reports has to be approved by Access. Okay. And we'll make this our last question for the presentation today. Can the EP count a patient toward the measure of the patient electronic access objective if the patient accessed his or her information using a kiosk at the provider's office? If the patient accesses the patient information after the visit and the kiosk meets the technical standards listed below, the patient could be counted toward the measures for patient electronic access. So here are the standards that are required, and those come straight from the regulation. All right, and we are right at 4 o'clock. So Christine, I'll turn it back over to you.
Thanks, Alicia. Everybody on the line for 1 o'clock for us here in Arizona. I think sometimes we forget you're on the East Coast. I was like, 4? Oh. Anyway, thank you so much again, Alicia, and the Myers and Stofers team. Again, I apologize for the technical difficulties we were having, but thank you for presenting today on the Medicaid Promoting Interoperability PI program, Meaningful Use and Objective 5, Patient Electronic Access Information, and for responding to the questions posed by the participants today. Thank you to our participants for your questions and comments and for participating in today's polling activities. Each of you who have registered and participated in today's open forum will receive a copy of the slide deck along with any Q&As and other documents specific to the open forum. The call has been recorded and will be posted to the Health Current and Access websites along with any Q&As and other documents that were shared in today's open forum. This concludes today's presentation. Thank you, all of you, for participating, and have a wonderful rest of your day. Take care.